For all the night's introduction. I hope you're not gonna fall asleep. I will try to ask a lot of questions of the few of you that are left to keep you awake. So we are gonna talk about supplements in cancer and supplements in general. How many of us in this room are taking any multivitamin? Individuals, okay, that's good. How many are taking calcium? So a few of us are taking several supplements. How many of you did the doctor recommend it to you? The multivitamin or the calcium or whatever supplement you're taking? One, two. So supplements, we all take them. They are part of our life, and yet we don't have a good guidance on when taking them, when not, if we need to avoid them or if we really need them. So we are going to talk a little bit about it in general and during cancer. Oops. What did I do? How does this? So one of the things that happens with supplements is that the FDA does not regulate supplements, unfortunately. Then they came together and decided that they wanted to have a definition of what a supplement is. And they created this act, which is the Dietary Supplement Health and Education Act, to define what supplements are. And they came with the definition that is a product other than tobacco intended to supplement the diet that bears or contains one or more of the following dietary ingredients: vitamins, minerals, herbs, other botanicals, amino acids, concentrate, metabolite, constituent, extract, or combination of above listed ingredients. So it's like a box of everything in it, and it's confusing for the most part. So how many people use supplement? In healthy individuals, this was measured, and it was a study in a population at the same time that they study other complementary or alternative modalities that they were using. So the use of natural, sorry about that. Yeah. The use of natural products was 17.3% of the entire population. And it was the highest percentage of all the complementary modalities used by these people. When we compare these to cancer patients, and we are only going to focus on a few data points in this very busy slide of a real analysis of what breast cancer patients are doing. Sorry about that, I'm getting used to this pointer. So when we look, this is a study of breast cancer patients and how they take supplements or do other complementary practices. And most of the breast cancer patients had any of those supplements, use of supplements in all the studies that have been looked at. If you look at the bottom, that is what I want you to concentrate. Vitamins and herbs were 67% in a study. In the next one, vitamins was 87%. So why do people that are healthy use supplements? The reasons that were found in a study was to enhance immune function. This was a women's study. to treat menopausal symptoms and to enhance overall health. The faulty assumptions that were found was that, these are natural things, so they have to be safe. And we will see how that is not the case in some cases. And that since they have been used for such a long time, it should be very useful for me to take it. So let's look at the economics of supplements, which I found very, very interesting in the way that they have been developing throughout the years. In 2005, there was $713 million spent in herbs in mass markets, plus 1.4 million in natural health and food stores, plus $2.3 billion over the internet, which I think is a humongous number. But if you look at the estimate in our dating age, it's over $20 billion per year. It's a massive industry. The use of supplements changes by year in their popularity. So what does that tell you? So in 2005, garlic was very, very popular together with echinacea to fight infections and help you prevent for the flu and things like that. In 2006, green tea extracts became extremely popular to improve overall health. In 2007, the numbering of popular supplements increased, and that has kept going throughout the years. Noni juice, garlic, mangosteen juice, green tea, echinacea, ginkgo biloba, ginseng, milk thistle, and psyllium. And all of them were to improve overall health, and few of them really targeted to any specific symptom or disease or use. The use of supplements has grown and continues to grow over the years in all populations. In women, we usually use a little more than men. And that is the increase. It appears to be plateauing, but it's around 50%. And we are missing data from after 2006, but I couldn't find any farther than that. So use of multivitamins and minerals, that is by the National Health and Nutrition Examination Survey in all ages, spread out through the ages, through the span, the lifespan. I mean, when you look at children 1 to 3, and we are using 25, a quarter of these children are in some kind of supplement. It goes up by 4 to 8, goes down a little bit throughout puberty, and you can think that maybe the rebellious time. And then as we age, we keep taking more and more. So it's just fascinating to me to see how we are using these supplements. So cancer patients, we saw in that very busy about breast cancer patients, but our cancer patients, about 50 to 70% are using supplements prior to diagnosis, during the treatment, and post-treatment. To me, it's very bothersome because it's usually it's not just one supplement. It's not this more or less innocuous multivitamin that everybody takes, but is what we have been getting is these mega vitamins, and without any control, without any supervision from doctors. And cancer patients tend to not tell their treating doctors what they are taking or doing in terms of complementary or even alternative medicine. So why do they take supplements? To help them cope with the side effects of the treatment, to feel that they are really doing something for themselves to fight the cancer, because usually cancer patients feel that they have been taking their power away from them when they go into this treatment, and you have to do this and take this, and the doctor directs a lot of the treatments that they get, and also to treat or cure their cancer. There is a lot of misinformation out there about what some supplements may or may not do, and cancer patients are in a very fragile state, not physically, but mentally, to try to do anything that they can to deal with the cancer. So what are the concerns that we have? My number one is that we don't have a good regulation on these supplements. They may have multiple chemicals because of that, and they don't need to put it in the labeling, although we are getting a lot better with the labeling of most supplements. Most of them have not been tested in clinical trials. All of them have possible interactions with the treatments that we give, whether it's chemotherapy, targeted therapy, immunotherapy, etc. And the fact that they are not sharing it with the physician is just very bothersome. Although as things have become a little more popular and there is a lot of good information coming out, the patients are starting to realize that they need to share this, and that has improved a little bit. And then the other thing that we need to realize is that these supplements have side effects. It's like any other thing that we put in our mouth. So how can we try to find the best supplements? There are several organizations like the US Pharmacopoeia, that when the supplement bottle or box has the seal, is because it has been tested. So at least we can be sure that what we buy and the label and what we think we are buying is the same thing. So those are very important. The same with NSF. The Consumer Lab is a private organization that also has a web page that you have to pay to get into, but they test most of the supplements, and if that is where you can get good information on the supplements that may not have any of the labels that assure quality. The made in an FDA inspected facility is good, because at least we know that it's a good facility and it's not someplace in the middle of nowhere with possible infectious organisms floating around. GMP is a good seal to have, because it guarantees that, again, the product that you buy is what it states in the label. And made in USA, it takes away from, the product being made in a place that may be unsafe. So what are our information sources? There are many, right now, many web pages that you can visit. The USP and the NSF.org and the General Manufacturing Products. From the NIH, the Office of Dietary Supplements has most of the supplements listed and their use, their side effects. The National Cancer Institute for Complementary Medicine, Complementary and Integrative Health also has a lot of information on supplements use and side effects. More information sources, the All About Herbs from Memorial Sloan Kettering has a full compendium of supplements, and they are very good at keeping updating it as more information comes out on safety and uses and all those things. Emerson Ecologics is another, not a pharmaceutical, a supplement dispensing facility. They don't make the supplements themselves, but they sell them. And sorry, most of them, they test them themselves, so they list some that they have tested and can guarantee that what you buy is what they label, and then consumer lab that we talked about before. So what do our great institutions tell us about supplements? And I can just basically go very quick through these slides and tell you that what they recommend is not to use supplements. Not to use supplements unless you're guided by a physician and somebody really knowledgeable, knowing your medical history and what you're all about, that recommends any of these supplements. And we can just jump through these because of the time, but they are all basically telling you that special populations are the elderly, that they may need more supplements because they don't eat that much. NCI, again, caution using them. And then I wanted to talk to you about my favorite supplement, which is vitamin D. And this is a busy slide, but we can go through it easily. So where do we get most of our vitamin D? From the sunlight. Where do we live? Where do we spend our time, most of our time, every single day? In buildings like this. So none of us are producing any vitamin D. And vitamin D, although we keep calling it vitamin, we really need to think of it as multiple prohormones that are lipid soluble and that are very, very indispensable for many functions in life. So, of course, everybody knows that it affects our bone health, but it also affects the way that cancers may divide. Cannot see from here. It affects our immune system and defenses, affects the health of our skin, also affects our brain and immune system. I have said that before. So where do we have vitamin D that is not from the sun? In fish, and that really is truly mostly in cod liver oil, sorry. So I don't know if anybody has tried that. When you were a small kid, it was very popular, at least when I was growing in Spain, and my mother will feed me that, 1 full spoon a day. And the screams could be heard, very, very, very far away. It's the worst tasting thing I ever had, definitely. You can find it in all our fortified milk and milk products, whole grains, and some cereal. The metabolism of vitamin D, we absorb it from the sun, and then it goes, first step metabolization is in the liver, and that product, which is, this goes down to the kidney to become what we know as vitamin D3, which is the dihydroxyvitamin. That is the active form. In supplements, we can give it as D3, and it doesn't need metabolization, but we can also give it as D2. So why am I so crazy about vitamin D? Is because we have found that in some cancers, in some patients with certain cancers, the vitamin D tends to be low and lower than in non-cancer patients, and those cancers are colon, breast, thyroid, prostate, and lung. Then the vitamin D deficiency has been also associated to poorer prognosis in patients with deficiency, and sometimes in having more aggressive cancers. And the other thing that attracts me is that, there is this, if you're insufficient, if your blood level is from 0 to 20, you're deficient. If your blood level is from 0 to 20, insufficient is from 20 to 30. But then when you read the literature, especially in cancer patients, everybody recommends to have a level above 40. So it's a little bit confusing, and everybody, I think most of our population, because of the way that we are living right now, we are all deficient. We can assume that because we don't stay out in the sun, and then when we go to the sun, what do? We put sunscreen that blocks the production of vitamin D in the skin. So no way that we can win with that. And then we don't know much about all the racial differences. We don't know the optimal serum level. In normals, we think we do, but in cancer patients, I don't think we have a clear understanding. There is some genetic polymorphisms in the receptor of the vitamin D in the tissues, and we don't have that very well studied. And vitamin D is not non-toxic. If you overdose, and we don't know what overdose is, if you overdose on vitamin D, what happens is calcium gets deposited in vital organs like your kidneys, your liver, your blood vessels. So it can be fairly toxic. You can also develop hypercalcemia, and that is a huge problem, especially in patients with cancer. So it's not without a risk that we supplement people. So the recommendation is to always have it under somebody knowledgeable, and if possible, a physician, not to take it just by yourself. So in conclusion, physicians should be aware of the supplements that their patients are taking, whether cancer patients or any other patient. There is a lot of possible interactions of the supplements with the treatment, again, whether it's a cancer patient or a diabetic patient or high blood pressure. Do not overprescribe supplements. Always, if you're a non-physician, even if you're a physician, consult a physician that is knowledgeable about supplements. Know where to find the right information. Avoid supplements. This goes with the exception of calcium and vitamin D in a normal person. Eat healthy food. Let your food be your medicine. We need more clinical studies to prove the safety and the efficacy of these supplements. And there are, thank God, many sponsored clinical trials undergoing as we speak. So that is my main message. Eat healthy. Remember to eat your veggies. And if you have any questions, I will take them at this moment.